So whenever we're ready to record to the cloud, I believe.
Okay. It was 101. We started meeting.
All right, showtime. We're going to start letting some folks in now. Perfect. Good afternoon, everyone. Welcome to our second session of the Black Angels Book Club event. I am Dr. Danielle McCamey. I am the founder, CEO, and president of DMPs of Color. And it is such an honor and privilege to welcome you all back. And also, I'm especially excited to introduce my students at the Johns Hopkins School of Nursing who will be facilitating this wonderful session. And so they have a wonderful presentation set out for you on professional nursing education. So I do want to introduce Faith Metlock, who is the president of the Black Student Nurses Association. Give us a wave, Faith. Next, James Pointer II, who is the vice president of the Black Student Nurses Association. Ashley Harford, who is a peer mentor leader of the Black Student Nurses Association. And Kennedy Godwin, the secretary of our Black Student Nurses Association. And just want to welcome you all. And without further ado, I would like to turn it over to the Black Student Nurses Association to facilitate our session.
Thank you so much for that introduction, Dr. McCamey. I believe there will be an introduction by Maria first before we get into our session. So I will pass it over to you and then you can pass it back to us.
Hi, everybody. Thank you for joining us this week. I hope you're all enjoying the story. As you started to read, you start to follow the life of Edna Sutton, and we started to see themes emerge, the themes of stigma, race, loss, and the seeds of advocacy. And what I want to talk about a little bit and frame before I hand it over to the Black Student Nurses Association at Johns Hopkins University, who I just want to say thank you so much for joining us, is when I began researching this book, I am not a nurse, and the first thing that I learned about nursing history, was this hagiographic history of Florence Nightingale. Not that she was not important, but it seemed that all of nursing history was poured into this one figure. And so as I began to dig deeper and deeper into the history, I learned that Black women had been healers and midwives for hundreds of years before Nightingale. And I also learned that after Nightingale, the term nurse was rarely used for Black women who were healers and midwives. And so as the profession grew and nursing and the word nurse continued to be pushed out, Black nurses were unable to join the American Nurses Association. And so wanting to be seen as equal, in 1908, they formed the National Association of Colored Graduate Nurses. And in between the years of 1908 and 1933, a lot happened within the organization. But it wasn't really until 1933 with Stoppers and Osborne that it began, the organization itself, the NACGN, began to wield its power. Joanna is going to drop into the chat a wonderful article written by Nurses You Should Know about the NACGN. So I became kind of obsessed with Stoppers and Osborne. I fell down a rabbit hole. These two women were not only trailblazers, they were extraordinary. I loved how they had their eyes on the long game integration and how they networked in New York City, in Harlem. In the early 30s, they pulled in people like W.E. Du Bois and Adam Clayton Powell Jr. And they relied on the Black press, the New Amsterdam News and the New York Age. And I kind of looked at it as like they embarked on this extraordinary, what we would now call social media campaign to really keep nurses and what they needed at the forefront. What else they did was they began to inspire Black nurses to become advocates for equality by making healthcare into an issue of social justice. And that was extremely striking for me. And I really wanted that theme to come through. The lack of resources for Black women and the hard lines of Jim Crow led to the recruitment of Black nurses at CVU. While this ultimately turned out to be good for these nurses and for their future and for the profession, it also took a toll on them emotionally, mentally, and physically. And I don't think that could be ruled out when we read this story. Particularly, you'll start to see this with Edna, and in the next, in the next parts of the book that ensue, what they had to renounce and give up to come to CVU and to work as a profession. And so with no more, and so right now what I want to do is I want to turn this over to the Black Student Nurses Association at Johns Hopkins. They'll speak more about early nursing education, the landscape for Black women at the turn of the century. Here they are. Come back next week for a continuation on how persistent marginalization after the National Association of Colored Graduate Nurses disbanded led to the formation of the National Black Nurses Association and ultimately the Commission to Address Racism in Nursing. And that will be next week with Dr. Katie Boston O'Leary. And so with no further ado, here is the Black Student Nurses Association of Johns Hopkins.
Great. Thank you so much, Maria, for providing that background context on that portion of the book that we will be covering. On the behalf of our organization, we are truly ecstatic to partner with DNPs of color to be a part of this book club because it's so important and timely, especially as nursing students, for us to learn about the barriers that Black nurses overcame to get to where we are today. And so our goal is for us to have an interactive and engaging space where we'll collectively reflect on the challenges, triumphs, and transformations that have paved the way for modern nursing. And so for our session, we'll be providing some background context. And then the second half of the session will consist of a panel where we'll be joined by the wonderful Miss Virginia Allen to have a conversation around some of these topics. And so we have a lot packed into this short time with us today, and so we'll get right into it. And so I'm sure it's no surprise to us that the early professional nursing education featured many obstacles and barriers for Black nurses, including limited opportunities for Black nurses in the nursing education. And so in the late 19th and 20th century, while with the turn of the late 19th and 20th century, we saw an increase of nursing schools or nurse training programs. And most of these programs implemented quota limits for the admission of Black nurses or excluded them altogether. The New England Hospital for Women and Children, incorporated in 1863, limited their admission to one Negro and one Jew. It would take until 1878 for Mary Eliza Mahoney to be admitted and graduated in 1878. And while women for generations were responsible for care, the work of the 1896 Plessy versus Ferguson decision only sanctioned the use of racial segregation, and this extended to nurse training programs, which limited educational opportunities available. Starting in 1903, states began to adopt the Nurse Practice Act to standardize the nurse professional and educational accreditation and licensing registration, but many states subsequently refused to permit Black nursing school graduates to even apply for their nursing license registration. With racism and discrimination permeating through healthcare delivery and opportunities for trained Black healthcare professionals, a national network of Black hospital and training schools increased between 1890 and 1920. And by the 1920s, there were over 200 Black hospitals and training schools, including, but not limited to, Spelman in Georgia, Lincoln School for Nursing in the Bronx, Providence Hospital in Chicago, Dixie Hospital Training in Virginia, and featured here is the Mercy Hospital School of Nursing in Philadelphia. With the support of philanthropic organizations such as the Black Church and donations from Black organizations, these institutions not only delivered services to Black patients, but also created training and educational pathways for Black nurses. In the 1900s, we see that as opportunities for education and employment increased, professional organizations and alumni associations also developed. 52 nurses under the leadership of Martha Minerva Franklin formed the National Association of Colored Graduate Nurses in 1908. And 2 years prior, Franklin surveyed the conditions of Black nurses as a whole and concluded that while the American Nurses Association was open to Black nurses for membership, the statewide level membership was closed to Black nurses, which is what you needed at the time to be a part of the organization. So the NACGN consequently sought to advance the standards in the best interest of trained nurses to break down discrimination in the nursing profession and to develop leadership within the ranks of Black nurses. The organization established a national registry to assist nurses in finding employment throughout this country and published an official newsletter beginning in 1928. Most significantly, though, the NACGN's push for integration and acceptance of Black women into professional nursing was the prominent goal of their organization at the time. When we look into the 1920s, we see that during World War I, president of the NACGN campaigned for Black nurses' acceptance into the American Red Cross, as this was a presumed path for entry into the U.S. Army Nurse Corps to support wartime efforts. They were not permitted to actually join and serve until 1918 during the flu pandemic, though they supported wartime efforts through various avenues and other organizations. The Red Cross, with guidance from the Surgeon General, denied entry of Black nurses. The Surgeon General reported that they would be unable to provide necessary segregated lodging. And so by late 1918, the Red Cross nursing leader registered 77 Black nurses to the Red Cross, but they were not assigned to duty, likely due to anti-Black racism of officials. With the Spanish flu pandemic raging, the Army eventually called for 18 nurses to serve at Camp Sherman in segregated wards, and the service of these 18 nurses was the catalyst to Black nurses' integration into the Army Nurse Corps that would eventually occur in World War II in 1946. Along this time period, the Black Angels, which we have the pleasure of reading the book and learning more about their story over the course of this book club, they began to respond to their tuberculosis crisis, caring for infectious patients when white nurses refused, highlighting their dedication to nursing. When we look into the 1930s periods, the NACGN's greatest efforts in its later years of existence focused on full integration of Black nurses into the American Nurses Association. The American Nurses Association still allowed chapters to discriminate against Black nurses, which impacted their employment opportunities. Beginning in the 1940s, few states began to accept Black nurses into their organizations, such as the North Carolina State Nurses Association. However, after a series of proposals, meetings, and appointments, the American Nurses Association merged with the NACGN, eventually leading to the dissolution of the organization in 1951. Desegregation of the American Nurses Association unfortunately did not mean full integration. At a national ANA convention in Miami, Dr. Lorraine Sams called for a caucus to discuss the concerns of Black nurses. The group identified a need to address the specific health concerns of the Black community, needs of Black nurses, and voiced concern for the lack of Black representation in leadership roles and opportunities to partake in meaningful decision-making. A year later, the Black Nurses Association was formed with Dr. Sams as the first president, and the National Black Nurses Association still exists today and seeks to address the specific health needs of the Black community through research and policy, and collaborating with other Black organizations in shaping nursing education. Also during this time, also during this time, a notable organization that was founded is the Chi Eta Phi sorority, which is a professional sorority for Black nurses that was organized in DC in 1932 at the Freedmen's Hospital. And this organization was founded in response to the lack of employment and professional opportunities. And it functioned with the goal of elevating the plane of nursing and increasing interest in the field of nursing for Black individuals. So this is a lot of information and history covered during this period, and a lot of obstacles that had to be overcome for us to experience the modern nursing that we see today. But notably during this time period, there were also historical events that were occurring, including the Great Depression, where economic challenges intensified, impacting educational resources and opportunities for aspiring Black nurses. And so I'll play a short clip of the history of the Great Depression, and I'm sure they'll describe it better than I can.
The story of the New Deal is often one that focuses on how it lifted millions of people out of poverty and gave them a pathway to the middle class, the sort of life where they could buy homes and cars and go on vacation and send their kids to college. But many of these opportunities weren't extended to Black people, at least not in the same way, or nearly to the same degree. One of the reasons the results were mixed was because these programs were administered locally. And theoretically, that doesn't sound like a bad policy decision. It makes a lot of sense to decentralize aspects of the government so that things can be administered more efficiently, right? And local governments tend to know more about the people in their individual communities and what they need, right? Well, maybe. The thing is, local governments often also reflect local customs. And in many parts of the United States, local customs were inseparable from Jim Crow and white supremacy. So even though the federal government entitled Black Americans to many of these benefits, white Americans who were working on the local level often refused to give Black people access to these programs. Some Southern politicians prevented Congress from attaching any sort of anti-discrimination provisions to a number of social welfare programs, including community health services, school lunches, and hospital construction grants. What's more, there were parts of the New Deal that were specifically constructed in ways that prevented Black people from having access to some of its most economically generative programs. For example, farm workers and domestic workers were not included in the Wagner Act and the Fair Labor Standards Act. According to the historian Ira Katz Nelson, these groups, constituting more than 60% of the Black labor force in the 1930s and nearly 75% of those who were employed in the South, were excluded from the legislation that created modern unions, from laws that set minimum wages and regulated the hours of work, and from Social Security until the 1950s. The NAACP testified against the legislation leaving farm workers and domestic workers out of it, arguing that it was, quote, like a sieve with holes just big enough for the majority of Negroes to fall through. And this wasn't just some coincidence. It was intentional. Roosevelt really had to walk a fine line between his legislative priorities and the power of Southern Democrats in Congress. And Black people became a casualty in the process of finding a legislative compromise. So think about it. You give one of the greatest catalysts of intergenerational wealth to white people, and you very intentionally don't give access to those same programs to most Black people. And then people want to act surprised generations later when there are disparate outcomes along the lines that these resources were allotted. And the impact of this is compounded across generations and is part of the reason that the racial wealth gap still exists today. As Katz Nelson puts it, at the very moment when a wide array of public policies was providing most white Americans with valuable tools to advance their social welfare, ensure their old age, get good jobs, acquire economic security, build assets, and gain middle-class status, most Black Americans were left behind or left out.
And in addition to the Great Depression and the challenges that came from that migration, the Great Migration also is another time period, another historical event that occurred during this time period. And so we'll play another short clip with the details of that, and then I'll make sure.
Had more in common with the vast movements of refugees from famine, war, and genocide in other parts of the world, where oppressed people, whether fleeing 21st century Darfur or 19th century Ireland, go great distances, journey across rivers, deserts, and oceans, or as far as it takes to reach safety, with the hope that life will be better wherever they land. Newspapers like the Chicago Defender and other informal networks like church groups, benevolent societies, and Black Pullman porters told the stories of many Black Americans who were thriving in the North. And that encouraged many Black Southerners to take the risk and come join them. But once they arrived there, things weren't just magically better. Oftentimes, things remained really tough. Poverty was widespread, and segregation was still in place. Racism, while it may have looked different in these urban cities, wasn't just limited to the South. So Black folks established benevolent societies through churches and other organizations to help new migrants and their families adjust to life in the North. Another fascinating part of the story of the Great Migration is that many white people in the South, as more and more Black people began to leave, actually got nervous and were worried that too many Black people were leaving. See, as terribly as Black people were treated on a social and political level, the economic infrastructure of the South relied heavily on Black people's labor. Some employers increased their wages to stem the tide, but most of the time, that wasn't enough. White Southerners got so desperate that they tried to pressure newspapers into telling more negative stories about Black life in the North. They would block trains and buses filled with migrants from leaving the South, and even beat and intimidated people for attempting to leave. I mean, think about it. You were beaten if you stayed, and you were beaten if you tried to leave. That was Black life in a nutshell. Something to remember is that no matter what, it is never easy to leave home. Though much of the land Black people lived on in the early 20th century carried a lot of pain, it also carried a lot of memories. It was part of their lineage. It was part of their history. Leaving home isn't easy, but that also shows you how desperate people were for both economic opportunity and for safety. And while it wasn't perfect for many, the North and the West did provide that. People were able to get economic opportunities that they otherwise just wouldn't have had. And while, to be sure, violence against Black folks did exist in the North, it wasn't nearly as extensive as it was below the Mason-Dixon line. What's more, the Great Migration created huge hubs of Black urban spaces and culture. It would go on to give us some of our best artists, musicians, and writers. The Great Migration was nuanced, complicated, and dynamic. And the story we tell about it should reflect that complexity. It's not just a story of what was done to Black people, but serves as an example of Black Americans taking control of their lives, identities, and destinies in a country that was constantly attempting to strip all of those things away from them. The writer Isabel Wilkerson puts it best. Over the decades, perhaps the wrong questions have been asked about the Great Migration. Perhaps it is not a question of whether the migrants brought good or ill to the cities they fled to, or were pushed or pulled to their destinations, but a question of how they summoned the courage to leave in the first place, or how they found the will to press beyond the forces against them and the faith in a country that had rejected them for so long. By their actions, they did not dream the American dream. They willed it into being by a definition of their own choosing. They did not ask to be accepted, but declared themselves the Americans that perhaps few others recognized, but that they had always been deep within their hearts.
Great. So as we just learned in this video, Black populations moved from the South to urban areas, influencing the demand for healthcare services and nursing professionals at this time. And so these historical events notably influenced the early professional nursing education and led to some of the things that we still see now in the modern professional nursing. And so we have
Had more in common with the vast movements.
We have an interactive question now for you guys. In your nursing education, were you taught about the experiences and challenges faced by Black nurses in history, or were you, taught about some of these historical events and how they influenced nursing opportunities? And to answer this question, you can scan the QR code here with your phone and respond, or you can go to this website, polleave.com/mynamefaithmatlock205, or you can send it via text message. So if you text 22333 and then send Faith Matlock 205 and then write your response, we'll start to see it live on this slide when the response is coming. So some responses are coming in already with one something now. I'll keep this up just so you guys can keep scanning and responding. Yeah, so I think a reoccurring theme that we'll see is that this information is not readily taught to us in our professional nursing curriculum that we see today, and often arguably not even taught in other forms of curriculum that we have in school. And so it's really important for us to have forums like this where we can come together and to do our own research and learning about this information and uplifting it and reading stories like the Black Angels, because this information is not readily made available to us. And so the next question that we have for you all, and then I want to acknowledge some of the responses about someone being the only Black student in their nursing program. Definitely can understand the feelings of being the only one. and the challenges that come along with that, and that being too often the case for us. I've begun teaching it in the courses I teach. That's amazing. Yes. We have to take action and take accountability for teaching this in our courses and teaching others and however we can. Not at all taught. I was taught absolutely nothing about this now. It's very sad. Not included. Even despite expressly asking professors for examples, yeah, it's something that is not a common knowledge amongst some of the people that we have in positions of leadership, and that's pretty sad that, you know, even some of our leaders are not aware of some of this history and how the impacts of what have happened in the past are still permeating and affecting things today. What about Mary Mahoney? This topic was barely touched upon. As a nurse educator, I'm hoping to change that by incorporating the stories of Black nursing history and active anti-racism content into our courses. Yes, like we are all charged with the responsibility of, now that we know, sharing this with others and using it, using our platform and our roles in these spaces to make sure that the next generations and everyone is aware of these challenges that had to be overcome so that we can experience the privileges, and air quotes around privileges, I'll say, that we have today. Another question that we have for you guys, or for you all, is considering the impact of the Great Depression and the Great Migration through the videos we just heard on nursing education, how do you think economic conditions today still affect the nursing profession? So, same way you can answer this question. Some responses coming in. I'll go back. Just need the QR code. Yeah, so for some of the responses that are coming in now, a lack of a midwifery model of care, yes, certainly, and we know that is related to economics. Still underpaid, yes, especially if we look into some of the sex disparities and the pay gaps for, you know, females versus males, or women versus men, if we think about gender role differences. A huge percentage of nurses of colors are LPNs and aides, yes. And so there's been a lag with nurses being able to pursue some of these higher educations that are now being enforced or recommended that we have, but not keeping in mind the barriers that may put in place for some individuals, and missed opportunities for our patients who still are in need of, you know, nurses, and there being a major shortage. Not enough nursing schools. Yep, that goes right into that point. Not enough instructors, not enough not enough people to meet the needs of the patients that we are still in need of service. And so economics are definitely deeply rooted in that. Very hard to complete DNP programs due to lack of financing. Yep. Disparities continue to exist that can decrease the number of students able to enter nursing. Certainly, I know when I just reflecting on my time in nursing school, it was definitely challenging. Going to nursing school, doing the curriculum, doing clinicals, and then trying to survive or having a job outside of that too. It certainly creates so many obstacles, and it's hard to get through if you don't have support. Most education dollars still go to graduate medical education versus nothing. Yes, that's still something we're pushing towards. Expensive to attend nursing school, very expensive. The fees add up, the books, the uniforms, and all the stuff that you have to pay outside of even tuition are just more barriers. Many aspiring nurses, difficult to get into nursing school. Yes, even more. than it was in the past. Direct money, access to higher, not enough opportunities, yep. Broken reimbursement models, racial disparities. So these are some great responses. Mhm. Yeah, we strive to move in PhD programs. We barely exist in these spaces, if at all. I certainly can attest to that, especially as a PhD student at Johns Hopkins. There's not a lot of us in these spaces, and it's certainly challenging. So I think as we see collectively with these responses that have came in, that we are still dealing with the effects of some of these historical events like the Great Depression and Great Migration. And we are arguably a long way from where we need to be. And so we can continue some of these discussions in our panel portion that we have planned for you all today. I want to make sure we have enough time for that. And so I will pass it to Ms. Kennedy Godwin, who will be the moderator for our session today, to lead us into this portion of the session.
Thank you. We'll start with some intros. So I'm Kennedy. I'm originally from New Jersey, and I'm the secretary for the Black Student Nurses Association. We'll introduce Ashley next.
Hi, my name is Ashley Harford. I'm originally from Brooklyn, New York. I am the peer mentor leader for the Black Student Nurses Association. I'll pass it over to James.
Hello, everyone. My name is James Burnett II. I'm originally from North Carolina, and I serve as the Vice President for the Black Student Nurses Association at Johns Hopkins University School of Nursing.
Okay, great. And Faith.
Yes, sorry, I was just gonna, so my name's Faith. I am a PhD student and nurse at Johns Hopkins School of Nursing and president of the Black Student Nurses Association. And my colleagues who just introduced themselves, they are current MSN students at the School of Nursing. This is very timely for us as current students at the School of Nursing to have this discussion. I'm originally from Cleveland, Ohio. I completed my BSN at The Ohio State University.
Okay. So the first question I'm going to have is going to be for Ms. Virginia Allen. If you could please share your experience working at Seaview Hospital during that period and your nursing training.
Thank you for inviting me. I've enjoyed the presentation so far, and I've learned a lot. My introduction to Seaview Hospital was at a very early age. I graduated from high school, and I came to Staten Island to live with my aunt, who was a registered nurse. And I lived with her before working at Seaview and going to nursing school. I happen to have run over some papers. This is an article that I know it's not as legible as I'd like it to be, but this is of my Aunt Edna Sutton Ballard and my Aunt America Sutton. An article that was written about them and the legacy that they left. My work at Seaview Hospital started as a nurse's aide. And over the years, I took a test and went on to nursing school on Welfare Island. This was a school set up by the Department of Hospitals to train nurses' aides to become licensed practical nurses to fill the gap of the shortage of nurses. And I'm very happy that I took that course. It has afforded me many opportunities that I don't think I would have enjoyed had I not. And I've enjoyed nursing.
Thank you. So what were the roles of nursing organizations for you during that time?
During that time, I was quite young. I was 16. I left Seaview Hospital when I was 26. I did not join any nursing organizations, but I did join other community organizations. I didn't become active in nursing organizations until I was in my late 20s, early 30s. And I always wanted, as I worked in nursing, I always wanted to join the Black Nurses Association, but I couldn't afford it because I was a single mother, and money was quite tight at that time. And my daughter became a nurse due to my urging. She moved to Oklahoma, and she wasn't able to get a job. They said she was overqualified. She had her BS in political science and education. And I advised her to go into nursing, and she loved it. As a matter of fact, before she took her board, she had a job in administration. And unfortunately, my daughter is deceased, but I have two lovely grandsons.
Thank you so much for sharing with us. So I know my fellow members of the Black Student Nurses Association were all a part of different nursing organizations. So can you tell us how that has impacted your time at the school so far? Whoever wants to answer.
So for me, I had the opportunity to go to the MBNA conference in Atlanta back in August, and there I was able to network with other Black nurses across the country and like hear some of their stories and connect with them and have they gave me like good information about like being a Black nurse, like aspiring Black nurse, and how to like navigate that because the percentage of Black nurses like in America is like very small. And so like going to that conference like allowed me to like network with other Black nurses and like learn more about the profession through their perspectives.
I can speak on that next. And thank you, Miss Virginia, for sharing your experience. And sorry again for the loss of your daughter. Thank you for sharing that. And when you mentioned that you couldn't afford at the time to join the Black Student Nurses Association, that's something that I appreciate is that we have this organization here at the School of Nursing that's free for us to join. And, we get funding to put on different events for the students on campus. So that has been something that I've really enjoyed having here because it allows us to have an experience where Black students have a space to share their lived experiences at a predominantly white institute. So for me, the Black Student Nurses Association has been just a really important part of my time here at Hopkins. And then I've also joined it's called like the Birth Companions program. It started off as a course, but once you complete the course, you can work essentially as like a doula And it's like a paid program. So we're able to assist birthing parents through that process through like prenatals, and then also assisting them through their birth. And then we do a postnatal follow-up just to discuss, what worked and some things that could be improved on, going through like another birth. But yeah, so those are some of the things that I've been a part of here at the School of Nursing.
And I would like to add that last year I was awarded a lifetime membership in the American Nurses Association, which was quite fulfilling and thrilling for me, because during my work time, I just couldn't afford a fee. So I was very grateful to receive this membership, and I cherish it.
Oh, that's amazing. Congratulations on that.
Thank you.
All right. So what would be some common misconceptions that people have about our roles in nursing, and how do you think that we can combat these? And it could be for the Black Student Nurse Association or Miss Virginia, if you'd like to answer that.
I think I would like to hear from the Black student nurses, since you are currently working in the facilities. I have been out of the facilities since 1995. And then I'll add a comment.
Sure, I'm happy to respond to that first. I'd say some of the common misconceptions that I'm hearing of now or experiencing now are just that, nursing is limited to bedside nursing, which we know is not to be true. There are so many paths and so many routes that you can take in with nursing. And so for the route in which I'm pursuing, which is to become a nurse scientist, I find myself constantly having to educate people and make them aware that nurses do research. We are qualified to be in these spaces. I'm still a nurse, and I'm just applying my expertise in another way. And so in ways to like combat that, I've just been trying to use my position to educate other people who are interested in nursing, that there are a lot of routes and ways in which that you can go into, and that and just trying to pull up the next generation as I'm in these spaces. As I shared earlier, I'm often am the only Black student in the spaces that I am in research. And so, being very conscientious of how I can use my platform to open doors for people to come after me, because we need us in these spaces. And there are a lot of areas that we can fulfill with our nursing expertise. And so making people, especially our medicine colleagues who seem to, want to keep us in a box, pushing against that narrative and showing them that we do great work and this work is important. And we offer a perspective that has long not been at the table. And so hoping to change that moving forward.
Thank you, Faith, for sharing that. And I definitely agree with everything that you've said there. Just kind of going off of that as well, I feel like a misconception, because I'm still a nursing student, so I haven't exactly worked in the role of a nurse just yet. But I feel like one misconception that I've noticed is that even like nursing students sort of feel like they don't have like agency over, like, or sort of just making an impact in their patients' lives that they're caring for. And I think that even as a nursing student, it's important to realize that you have agency over that and you're able to actually make an impact. And an example I'd like to share is, for example, that there was a patient that I had one semester who, I cared for them for the morning, and I was getting ready to do like afternoon vitals. And I noticed something like a change just from what I noticed speaking to them in the morning. And essentially I caught that they were having a stroke. And that was something that I was able to bring to not only just my clinical instructor, but the nurse that was assigned to them. And then also just like call a BAT, like a brain attack team, to come down and see the patient. And they were thankful for that, and saying like, even as a nursing student, like it's important to realize that you actually do have an important role. And it's important to speak up and to realize that everybody who cares for the patient has a specific role, and you actually have to do your part and to speak up and to not be intimidated and say like, well, I'm just a nursing student, what do I know? Because you can make a difference in saving a patient's life.
Thank you guys for your comments. Ms. Virginia, did you want to add anything to that question?
Experience with nursing to know that I wanted to make sure I had unmuted myself. To see that there are so many different disciplines that nurses are encouraged to pursue. Teaching, I'm sorry. I was trying to mute my phone. Teaching in the regular nursing programs, as well as the higher education, the colleges and graduate schools, wherein when I was in nursing, there were very few Black nurses who were in those categories. In Seaview Hospital, we had a big education department run by very well-educated Black nurses. But outside of that, I did not see any Black nurses in the colleges teaching in the schools of nursing. So we've come a long way. And I'm happy to see the progress.
Yes, we have. So we have one more question that I'll ask to Miss Virginia, and then if anyone has any questions, they could put them in the chat, and then after she's done answering, I can go through, and it could be for Miss Virginia or for anybody on the Black Student Nurses Association. You could put them in the chat. So for the last question, what is one piece of advice that you would give to someone starting their nursing career?
Nursing is a very special profession. I would say it's a calling. You really have to want to be a nurse. And if you find that you're not really cut out for nursing, you should step back, step aside, and give someone else who has the ambitions to be a nurse to go forward. But I would say stick to and to be very, very intentional about that, because we have, unfortunately, too many people in nursing today who really should not be nurses. They should be working in offices because they do not have the patient's well-being at heart. And I'm very happy to see that there are still quite a number of nursing schools and Black nursing schools at that. And hopefully we will fill the void of shortage of nurses, because good patient care needs the proper number of nurses for optimum care. So that would be my suggestion.
Definitely agree. Had some good points. Did anyone on the BSNA want to add to this question? Any advice?
Yeah, I can add to that. A piece of advice I would give to someone starting out in this field would be like staying true to yourself and knowing your why and remembering that going forward in your career, because nursing is like, it's not a one size fits all. You have to go for what you like want out of nursing. Like instead of like listening from like others like telling you what you should do in nursing, like make sure you stay true to like why you came into nursing. Because like even as like a new grad, you hear a lot of you have to start here before you like go other places, but that's not always the case. Like at least like for me, I'm starting out in the ED as a new grad, and using that to like work towards my DNP in acute care. So remembering your why as you go forward in your career is very important, because it not only helps you at the end of the day, but it also it's like helping patients' lives.
Thank you so much for everybody and their advice. It was really, really good, and everyone sharing their experiences, and Miss Virginia Allen for sharing her experience. If you have any questions, I'll go through the chat and see. Oh, I think I see one for you, Faith. Can you share a little bit of your experience being a nurse scientist, or in the PhD program?
Sure, happy to. Yeah, so as I mentioned, I got my BSN from The Ohio State University. I am a third generation nurse. My grandmother, she started her nursing journey in 1968, and I'm very fortunate that she's still here with me. And I've learned a lot from her experiences, and with my mother, she's still currently a nurse. And so I always was drawn to the healthcare field, but I wasn't sure exactly which role I wanted to fulfill in that. And so I knew within nursing that the options were limitless. And if I wanted to change my mind, I could at some point. And so that's what really appealed to me in nursing. But I say all this to say that when I was in nursing school and we were doing clinicals in the hospital, I realized like my passion for wanting to care for patients, which led me to wanting to go into healthcare, was limited in what I could do as a nursing student in the clinical setting, because there's only so much you can do when you are seeing patients in the hospital that come in with exacerbations. And so I quickly I realized that I wanted to prevent people from getting to the hospital and catching them sooner than in those encounters. And so I realized that I needed to go out in the community and bring my skills to them in that way. And so that inspired me to look into research. And so I was at Ohio State. I heard of a nurse scientist, and I never knew this was a role that we could do, or this was what people did. And I always thought of research as like lab rats and doing it in that way. But then when I met my mentor at Ohio State, she was doing community engaged research, and I saw how she was like creating studies for at the time for Black males, and we were like working out with them and providing them with education and resources, and really helping to prevent them from developing chronic conditions. And so that inspired me to want to do similar work. And so my research focuses on cardiovascular disease prevention. I explore social determinants of health and how they impact the self-management and prevention of cardiovascular conditions among underserved groups. So much of my work focuses on being out in the community, doing like blood pressure screenings, providing education and resources, and answering questions that often haven't been asked for these populations. How can we best meet them in the spaces that they're at? What are some skills or tools or ways that we can equip them to better manage their health? And so through my work, I'm hoping to develop a program of research where we can change the focus from helping patients when they have exacerbations to now how can we prevent them from ever developing these chronic conditions, and what are some lifestyle changes and ways that we can support these communities from a holistic and health equity standpoint. And so that's what I do, but there's not a one size shoe fits, like James mentioned, when it comes to nursing, and same for nurse scientists. You can do community work, you can do work more bench science in the lab, or you there's just, the opportunities are limitless in terms of like a topic that you may want to focus on and what you can do. But overall, as a nurse scientist, you generate questions and then you find solutions to them. And so I found that really nice to be in this space where you can make a change for people moving forward.
Thank you, Faith. I think we'll quickly do one last question that I saw here for the panelists. How do you prioritize your self-care?
I guess I'll go first. So for me, even though I'm like my first priority is to be a student, I make sure to make time for my friends, family, and just anything that I feel like is going to help me to recharge. Because this program is very stressful, and then just dealing with or rather experiencing the different things we see at clinicals or during our volunteer experiences can be really taxing on us. So I just make sure that I find a way to just like rewind and relax each week to prepare myself for the next week that's coming ahead.
For me, at the end of the day, you have to remember that you're human. You're human first before you're anything else, and you have to take care of yourself before you can like put yourself in these other roles to be taking care of others and like showing up. So remembering at the end of the day, like you have to take care of your person first before you take care of others. So that's how I prioritize self-care, and knowing when to like take a step back and just like ground yourself again before you like continue.
Very good advice that I like to try to take myself. At my age, I'm slowing down quite a lot, more this year than before. So I have to first ground myself and make sure I have a proper diet, enough rest, try not to stress about anything. And those are important things to do for yourself before you can help others.
Yes, thank you so much. So that'll be the end of the panel discussion. I'll throw it back to Dr. McCamey to close this out.
Or actually, before that, we have just one last slide for you. Just as a close to our presentation, we just wanted to encourage you all to just get involved as we shared throughout this presentation about the importance of Black nursing associations. There are several that you can join, so we encourage nurses to become members of these prominent Black nursing organizations, such as the National Black Nurses Association or other regional chapters. And then as Ms. Virginia Allen shared, there may be barriers in terms of finances with joining these nursing associations, and we are very cognizant of that. And so other ways that you can get involved include mentorship, volunteering to be a mentor for an aspiring Black nurse, and then joining mentorship programs where you can support students and early career professionals, are other opportunities and ways for us to give back and make sure that we're pulling the next generation up. And then last but not least, certainly, is advocating for inclusivity in healthcare. So engaging with Black nursing organizations that focus on advocacy and policy, and participating in these initiatives aimed at addressing healthcare disparities and promoting inclusivity. So we'll skip that. And Dr. McCamey, I'm going to close this.
Oh my gosh, give a virtual round of applause to my students. They did such an excellent job. I am one proud professor over here. Also, thanks to Miss Virginia as well. Always good to see you. And thank you for always imparting your infinite wisdom to us. I also want to give a special thanks to our Director of Student Affairs, Miss Regine LaForest Sharif. If she's in the building, would love for her to say hi, but I know she's been multitasking, but special thanks for her for,
Just move around.
is she here?
Thank you.
It was also her energy to forge the collaboration to have this opportunity for students. So thank you to her in reaching out and making it happen. And thank you to all of you all for coming. I also want to just thank you all for your time and spending your Saturdays with us. But before we close, I do want to pass it over to Maria to go over our guiding question for the upcoming week.
So if anybody has any questions now and anybody wants to stay 5 minutes over, I'm happy to do that. There were some people who were private messaging about questions. They wanted to talk a little bit about the book. I don't know if they're still here or if they got off. So if you have a question, you know, I'm happy to answer it, or for anybody else, or to just start a discussion, I'm happy to do that. So I'll give you a minute to think about that, and then we can move on to the guiding question for next week. I guess one question is, you know, what are you thinking about the book so far and these themes of stigma, race, and loss, or any one of those themes that will continue to play out in the hospital setting? Well, actually, let me just rewind. So these themes were introduced at the beginning of this part. And then, so next week we are thinking about, like, how do the themes of stigma, race, and loss in part 1 continue to play out in the hospital setting and outside of the hospital setting in part 2? Part 2 of the book will take you outside of the hospital, and you'll start seeing more of how the nurses begin to advocate for themselves in terms of wanting to integrate into a Staten Island community, which was not welcoming at all to them. As you saw in the chapter Contagion on the Island, the people of Staten Island were not receptive to the Black nurses. They did not like them because of the color of their skin, but also because they didn't want another infectious disease hospital on the island. So that's one of the things. So if somebody asked just how far you should be reading, just read all of part 2. It's much shorter than part 1. And the book will start to move much faster now because the themes have been set. And I guess the question for you to think about in your own personal spaces, in which spaces do you feel comfortable or unwelcome in clinical or academic nursing settings today? And a lot of people touched upon that today, in how they felt unwelcome in both clinical or academic nursing settings. So that's something to start to, you know, you can think about it again as you read and you see what happens with Missouriya, who's another character that you're about to meet. I don't want to use the word character because she's a human. She was actually a real person. So another one of the nurses that you'll meet, Missouriya Lavinia Walker Meadows, incredible human being. And you will start to see how that plays out in and out of the hospital setting for her. I just want, one person had private messaged me to, or I don't know if they put it in a private message, or they asked about the impediments in writing the book. And that's a long loaded question. And I've talked at length about it to different people. I think we talked a little bit about it on the J&J podcast, but in general, the nurses did not have any archives. The story was built from oral interviews that I had collated over, you know, years and years. And so that narrative kind of built itself through their voices. The other impediment was a lot of gatekeeping. I was not welcome to look at whatever historical objects were at the Seaview. At Seaview, there's a sort of museum that they have, and it was very hard for me to get in. There was a lot of gatekeeping that happened in those years. So that was one of the problems. And the other problem was access to academic articles. I do not belong to an academic institution. And so it was really hard for me to access the articles, which is one of the reasons we put it in the resources, because they're expensive. You know, I was looking at, sometimes they wanted $40 for me to look at the article in 12 or 24 hours. And for somebody who's in the non-medical field, that it took me way longer than 24 hours to tease through some of these articles. Fortunately, I was able to gain access to them later on. People were generous enough to get them for me, or, you know, certain libraries had them. But that was one of the things that was difficult, the access to older articles as well. Lots of things are not digitized, which is why I'm trying to collate this archive that I created and make it completely open access in whatever way we possibly can. So, you know, there were lots and lots of other impediments that happened, but those were the two main ones. Any other questions or anybody want to make a comment? Otherwise, we can just wrap it up and look forward to Dr. Katie Boston Leary's presentation next week, where she'll pick up on these themes and look at how the integration played out in this, you know, commission. I forgot the name of it now. It just flew out of my brain. Joanna, what is it? The Commission Against Racism, is that what it is?
I got it. It's the National
it.
Commission to Address Racism in Nursing.
Yes,
and,
thank you so much.
You're welcome. And I'll be
blanked.
presenting with Dr. Vivian Pierce McDaniel. So I want to make sure I put that in the room.
Sorry about that.
No worries, no
yeah,
worries.
That's great. So we're excited about that and excited to continue this conversation.
All right, thank you, everyone. You all enjoy the rest of your Saturday. We'll see you next Saturday, same time, same place. Bye-bye.
Thank you.